Vitamin K for babies, the benefits, risks, alternatives. Should you be having vitamin K for your baby after birth? Let me know in the comments below if your baby had the injection, the oral drops, or whether you declined for your baby to have this. So vitamin K is a fat-soluble vitamin that can either be given as an injection, usually within the first few hours of birth, or alternatively as an oral formation for your baby. The other alternative to this is to do nothing and to not give vitamin K at all. Here in the UK, the Department of Health recommends that all babies should have vitamin K, ideally as an injection. However, the alternative is to have the oral drops. Vitamin K in all bodies, adults and children, helps blood to clot. By helping the blood to clot, it stops massive bleeding from happening. And when it comes to decision making in pregnancy, it's weighing up the benefits, the risks, the chance of whatever this is happening, weighing up the alternatives, and then making a decision that feels right for you. And when making this decision, you should have been provided with all of the evidence, no misinformation, and then weighing up all sides of the story. Now, before science invented vitamin K, babies, there would be around about 180 to 200 per every 100,000 babies born die of something called hemorrhagic disease of the newborn. And that basically was after birth, these babies would have a bleed that would impact their brain, and sadly it would cause death in them. Scientists discovered around about the 1940s that by giving babies some vitamin K, an injection of a vitamin, it helped their blood to clot and completely reduced the chance of this bleed happening in the baby and stopping that bleed on the brain, therefore stopping death in babies. And there are three types of vitamin K deficiency bleeding. There is early vitamin K deficiency bleeding, which is one of the rarest kinds. This happens within the first 24 hours after a baby is born. The second kind of vitamin K deficiency bleeding is one of the most common, and that's what we call classical vitamin K deficiency bleeding. This happens in the first 1 to 7 days after birth. Then there is late vitamin K deficiency bleeding. This happens after 8 days old, however, can occur anywhere up to 6 to 12 months after birth. Now, the prevalence or the chance of a baby having vitamin K deficiency bleeding, if no vitamin K is given at all, is about 1 in 8 to 10,000 babies who are born. Babies who are exclusively breastfed, there have been some research studies to highlight that it is as high as 1 in 2,000 babies who are exclusively breastfed from birth. And the reason for that is because breast milk contains low levels of vitamin K, whereas infant formula, particularly the first stage, has higher levels of vitamin K. There are some risk factors for some babies who are more at risk of vitamin K deficiency bleeding, and the first one is premature babies. They are more likely to have vitamin K deficiency bleeding, and if they do have it, it's more likely to sadly end in neurological impairment, so that's where they have some brain damage or potentially death. For all premature babies, it is highly recommended that they have the injection. However, the dose is titrated, so it's changed. It's much lower for babies who are born prematurely based on their weight at birth. We've also got to think that premature babies are less likely to survive any brain surgery too, if they had vitamin K deficiency bleeding. During pregnancy, if mum has been on any anti-epileptic medication or cephalosporins, for example, that can also increase the chance of vitamin K deficiency bleeding in babies. In addition, babies who have cystic fibrosis or hepatobiliary diseases, they are also more likely to be impacted by vitamin K deficiency bleeding. So what are the options? So the first choice is to do nothing, give no vitamin K at all, and you remain at the same chance of vitamin K deficiency bleeding happening. Now, in these cases, you should be supported with your choice and be made aware and educated about the signs and symptoms of vitamin K deficiency bleeding, so that if these happen in your baby, you'll be able to seek medical attention as quickly as possible. And the signs and symptoms of vitamin K deficiency bleeding include lethargy, so baby being really sleepy and tired, having feeding difficulties, not wanting to feed, reluctant to feed, having bulging fontanelles, so their soft spots being really increased and swollen, having their respiratory rate, so their breathing rate going down, so decreased breathing rate, baby having fits, also not being very conscious and looking very pale. Other signs can include bleeding from the skin, bleeding from the gums, for example, or the nose, bleeding after things like circumcision or a tongue-tie division, bleeding from the cord itself, or alternatively bleeding from sites such as vaccination sites or cannulas. The treatment for vitamin K deficiency bleeding is to give vitamin K. So the treatment for it is vitamin K itself. However, it's being aware that that bleed on the brain may have already happened, and so that brain damage has already occurred potentially, and possibly it may still lead to death. It does depend on how quickly the vitamin K deficiency bleeding was detected and how quickly it was treated. So option number 2 is that you give the injection of vitamin K, which is recommended. This is 0.1 mils in total, so one drop that is going to go into baby's thigh somewhere after birth. The main risks of this injection are that it's an injection, so it can cause pain and discomfort. This can be minimised by breastfeeding, cuddling your baby, having skin to skin with your baby. And similarly, it doesn't have to be immediately postnatal, so you can still have that uninterrupted golden hour, that uninterrupted skin to skin in the postnatal period. But as soon as it comes to a point where baby's being weighed and checked over, that's the point where vitamin K can be given injection when you feel comfortable and ready to do so. Having the vitamin K injection reduces the chance of vitamin K deficiency bleeding down to 1 in 100,000 births. It's incredibly rare to have vitamin K deficiency bleeding after having had the injection. For the list of excipients and ingredients, go and check out part 1, vitamin K. It is a fat-soluble vitamin. Now, there's another risk to discuss with parents, and that is that in the 1990s, there was a link made between giving the injection of vitamin K after birth and childhood leukemia. Now, back in the 1990s, there was a different medication type of vitamin K that was given, according to the research. Now, since the 2000s, every research done since, which has looked at hundreds of thousands of babies who have had vitamin K, have found no link between leukemia and vitamin K. And so at this moment in time in 2025, there is no link between the vitamin K injection after birth and the development of leukemia. However, research does change, and we have found a research study looking at millions of births that have found that there is a link between planned caesarean births and an increased chance of childhood cancers, and quite a significant increase too. And so if research changes, if there's new developments, if there's new research studies, then this could potentially change. And we know that that changes with cancer every single year. We know every year that there are new studies on childhood cancer and the possible links between pregnancy, birth, the postnatal period, and what we know now could potentially change at some point in the future. But right now, there is no link from all of the research we've got between the injection of vitamin K and leukemia, and there are so many factors in leukemia. And in terms of safety, there's only ever been one anaphylaxis case in the world in Turkey, highlighting how safe vitamin K is, because this has been given quite routinely since the 1960s, and so we've got lots and lots of babies who have had this, and only one case report in the world of a reaction to vitamin K in the postnatal period. And the third option you have is to give oral vitamin K. Now with oral vitamin K, this is 0.2 mils, it's slightly higher, and that's because the absorption through the gut wall is slightly less than the injection. It's also slightly less effective as well than the injection too. So the chances of vitamin K deficiency bleeding, if all 3 doses are taken, are around about 1 to 2 per every 100,000 babies. The first dose is given immediately postnatal, then you give another one at 7 days old, and then another one at 28 days old, especially if you are exclusively breastfeeding baby. However, the research does highlight that if all 3 doses are not given, then the chance of vitamin K deficiency bleeding happening is slightly higher, as high in about 1 in 30,000, particularly if only the first dose of vitamin K orally is administered. One of the problems with oral vitamin K is every country has a different protocol in relation to it. Some have much more frequent vitamin K being given in the postnatal period. Here in the UK, it's 2 milligrams, so 0.2 mils, given 3 times. The main risk is it's quite fizzy, it can often be spit back up, and sometimes babies either don't swallow it or absorb it. And that's another reason why it's slightly less effective than the injection. But it's more effective than not having it.